So, um, well, it's total panic, right? We don't know what to expect. It's happening quickly, and it seems like it's going to last a while. Um, we need to breathe, and I mean, like literally, seriously, together. Let's take a deep breath. It feels good, and I'm sure you haven't done so consciously in the last several days. So, just take a deep breath with me, and we'll get started. Breathing is also going to help you better absorb all this information that we have to share with you today, and there is quite a lot. So let's get started. This is what we would like to see ourselves as during a time of crisis and during difficult times. This is how it probably really feels for most of us. I know this kind of looks how like my week in a nutshell. And so we have a lot to deal with. What I want to address with you guys first and foremost is the qualities of leadership. And whether you are running an organization or working for an organization, all of us have to step up into leadership positions right now. And so and we're going to go over these points that were so generously offered by Deloitte. And we've put the link in on the slide there for you. Just go spend some more time with it after when you get our slides after this presentation. But at the heart of everything that we're doing is our mission, obviously. And as difficult as it may seem right now, we have to put the needs of others before our own. And we have to stabilize. We have to take quick action. Charities are not usually very good at taking quick action. Some are, some aren't, but usually there's a lot of steps, a lot of decision makers involved, and it can be frustrating at times. And so this crisis is really forcing charities and nonprofits to react quickly, and I know that can be scary for some. Your board of directors should already be involved. If they aren't already, you should be thinking about planning an emergency call to get their support and help you plan the next few weeks and months. When you're planning your communications, you need to find a message that is specific to your organization. I'm sure you've felt it in the last few days. I know that my inbox was inundated. There's so much information going around. People are overwhelmed. And so it's really important that you demonstrate the relevance and the implications of COVID-19 relating to your organization. This is not the time for generic responses. You really have to contextualize it for your organization and what it means to your operations, and be as specific as possible. It's going to require transparency, and we've been talking about transparency in the sector for quite some time, but now we need it even more than ever, because it's going to be essential to be authentic and honest. And so if this crisis is going to have a significant impact on your organization, don't hide that from your stakeholders. Be truthful about it, and people will show up to help. I can, well, not guarantee, but I have a really strong feeling that people are looking to help those who are in need right now. You also have to plan long-term, right? So what we're recommending is that you have two plans. You have a plan for the new reality, which is going to be our next 3 to 6 months minimum, and then a plan for when things go back to normal, whatever that new normal will be. We're not really sure at this point. But what's important is to have two game plans. And I understand that it's super hard for most organizations, especially the smaller ones, to get even one plan in place. But now that many people's programs and services are slowed down because of self-isolation, now is the best time to be doing that planning. So I find that illustrating with real examples helps. So I'm going to get a little vulnerable here and share my own experience. I've been running left, right, and center for the last week, reacting to this crisis. My number one priority was my team. Without them, we can't move forward. Then we set up protocols to get through the crisis. Before COVID-19, we had nothing in place for crisis management. And I'm embarrassed to admit that we didn't practice what we preached, because we're forever telling our clients to have those in place. But in less than 48 hours, with the help of our B Corp community, our team, and a little research on the internet, we were on the right track. 48 hours after that, we made these slides for the webinar. So we've been moving really, really quickly, proving that where there's a will, there's a way. Once our team was comforted and had confidence that we were going to be able to face this crisis together, we focused on our clients. who are going to be the most affected, who the least. We made a spreadsheet with color coding about who should be contacted first on level of their emergency. We didn't have all the answers right away, so we at least reached out to everybody to tell them that we were taking action. We just didn't know what those actions would be right away. So with 80% of our clients in health and education, you can just imagine that last Friday was an unforgettable day in my 24-year career. And regarding digital capabilities, we're fortunate enough that we've been working in the cloud for more than 5 years, and we had several tools in place that already allowed us to work remotely, thank goodness. But in view of how long we could potentially be in isolation, we had to improve our systems and even add even more tools. And with the internal team, we were doing okay for the short term, and we were quick to adapt, luckily. But with the clients, that's where we still have a lot of work to do. And we're still, through the weekend, I'll be looking to implement some new features, and our technical team has been working to install a live chat feature on our website so that we have tools that will help people stay connected with us despite the social distancing. So we're really trying to react quickly and thinking about how this is going to affect how people want to reach us. Over the last week, we've had to make quick decisions to differentiate important from urgent. And it's forced us to review our timelines and our priorities, and it threw a whole lot of things right out the window. As the CEO, I felt the weight was entirely on my shoulders, and I wanted to protect my team and my clients, but I had to allow myself to be a bit vulnerable and finally ask for help. And in the end, I was able to delegate and move forward faster. So asking for help from my team and patience from our customers, that's what's been able to help us get through this first week. And from an accountability standpoint, making it clear to each of our team members what they were responsible for has really helped our projects stay on track. So I hope that in sharing a bit of that, of my personal story, there's something in there that you can relate and take back to your own teams in terms of how you want to deal with these 3 dimensions of priorities, time framing, and accountability. This is a really heavy document, but like I said, it's available in the link from the PDF that you'll get of these slides after the webinar. I really love this idea of respond, recover, and thrive. I like things that are in order. I like that this makes me feel safe in knowing that we have to take immediate action, but that there will be a positive outcome. So I encourage you to take a look at this amazing document that was built really quickly by the Deloitte team, and I'm very grateful for them to have shared all of this wonderful knowledge so publicly through their website. Now, I recognize that this is in a very corporate context, but there's so much of this. I'd say there's 90% of this to-do list that you can transfer to your not-for-profit organization. And it's a really great roadmap, especially with the accountability, seeing who should be in charge of what across all the stages. So I hope you'll take some time next week when things have quieted down a little bit to see how you can start applying some of these steps. In terms of communications during a crisis, we need to be clear about what we're talking about and concise. Like I said earlier, and I'm sure you've felt it, there is information overload coming from the radio, from social media, from email, from my mother calling all the time to ask me how we're doing. You need to minimize the amount of communication. Depending on your organization, you might need to share a lot of communication. This is going to be different for each organization and your stakeholders. So really look at who you're talking to and what they need to hear from you to feel secure. Your donors want to hear from you. They're worried about you. So try to give them some clear messaging. And in terms of messaging with your volunteers, be compassionate, be available, try to set up some ways that they can reach you. The easiest, fastest way to set out some information right now is on social media. We know that a good number of you are out there, so please use your social media channels responsibly. There's some bad misinformation that's spreading faster than the virus itself. So, we all have a responsibility to share, to fact check and share good information. And if you spot anybody who's sharing bad information on social media, and as it relates to your organization, make sure you stay on top of comments and all of those things to keep an eye out. Email marketing is going to be bigger than ever, obviously, and the phone. We're going old school, folks. I mean, this is a tremendous opportunity. We have volunteers who are stuck at home who have nothing to do. Why don't we give them a script, give them some tips, and have them call your donors, have them call your more vulnerable donors, perhaps your older donors who are feeling more isolated than ever. Ask them what your organization can do during this time of need above and beyond your normal services and programming. That simple gesture of reaching out and making sure that everybody's okay in your community is going to go a really long way once we get things back on track. The other thing is video conferencing. A lot of you are going to have to scramble to find ways to stay in touch with your board members, your volunteers, and otherwise. So looking into video conferencing tools is going to be a great way. You can also host a webinar like we're doing if you want to touch base. I've already had clients reaching out about converting their AGM to a video conference so that they don't have to postpone those types of events. And we'll be talking a little bit later about the different types of tools that are available. So all of these things should help you respond and in time recover and continue to thrive. And just take a moment to think about who you're talking to. And it's not business as usual. So if you have any communications planned, make sure that you adapt them to the crisis, that you don't just go into your regular direct mail pieces or anything else that you had planned without mentioning the crisis. You need to contextualize it for your organization and make sure your donors know what you're doing in response to it.